watching Let's Chat.
We're glad to have you here with us as we continue on Let's Chat for this Tuesday morning. And now we get to spend a few minutes with our buddy, Dr. Marc Cromie from the Chattanooga Allergy Clinic. Dr. Cromie, good morning.
Chip, how are you, my friend?
I am doing very well. It's good to see you again. We've missed you because of this coronavirus outbreak.
I mean, I don't understand how you can let a pandemic get between us, Chip. I thought we were tight.
And we are tight, brother. I'll give you a fist bump here towards the end of our little get-together here.
I mean, it's been a bad morning. I already found out all these women, beautiful actresses, are making a whole lot more money than we are.
They are that. They are that. Hey, getting into the meat and potatoes of this, obviously we're getting into the autumn allergy season. The ragweed count is going up. And a lot of people have sent in emails justifiably concerned about how do I know the difference between a seasonal allergy, maybe the early onset of the flu, or the coronavirus. I don't know the answer.
Chip, it's a tough situation we're getting into. And we thought it was bad enough during the spring pollen season when the corona just came out. I think this fall is going to be even worse. All right, so here's the deal. A lot of these, there's a lot in common. Runny nose, sneezing, and coughing can be symptoms of all three of these situations, whether it's ragweed allergy, flu, or corona.
Right.
But here's the thing about fall allergies. There is no fever, no body ache associated with this. So if you have a fever of 100.5 or more, this is not allergies. Allergies are going to give you the typical runny nose, which is clear. It's going to give you sneezing. It can give you a cough from postnasal drainage, obviously, and that's something that we do see quite a bit. But if you have any, I'm sorry, go ahead.
No, and despite the severity of some allergies, you know, if you have those and you do not have the fever, then you're essentially, I don't want to say marked safe, but you can rest assured it's not flu and not the coronavirus.
Yes, and typically allergy medicines like Zyrtec and Claritin, Allegra, over-the-counter nose sprays like Flonase and Nasacort are going to help with the fall allergies, but they're not going to help if you have the flu or if you have corona. And so those are things that if you have the fever at all and the aches and the pains, then you got to be tested. And obviously we need to make sure that everybody gets their flu shots this year to kind of prevent that aspect from coming in and clouding the situation.
Is this a good time to get the flu shot, number one? And question number two, is this a good time to get tested for allergies?
The answer to both is yes, my friend. Of course, the flu shots are already readily available. We're giving them to all our patients in all our offices. Also, you're going to see them at every CVS Minute Clinic. They're offering the flu shot. So I'd go ahead and get it now. In the past, we've kind of waited a little longer in the season, but I think we're trying to be aggressive this year to get ahead of it. Obviously, Chip, seasonal allergies, fall is our second biggest season over the tree pollens in the spring. So now is a great time to come to the Chattanooga Allergy Clinic and any of our offices, including our new Ottawa office, which will be open by the end of the year, hopefully. We can allergy test you to find out exactly what you're allergic to and tailor make you allergy shots or immunotherapy, which can change the course of this disease so you don't have to suffer every year.
All right, let me ask you this. The experts are saying it generally takes 2 to 3 weeks for the flu shot to get in your system and to build up the strength it needs. How long does it take if we're diagnosed with a certain allergy? You put us on one of your medications. How long does it take for that to get into the body and for it to start working?
Well, if we're talking about traditional allergy medicines like antihistamines, those work within hours. Nasal steroids will often work within a day of starting them, usually 12 hours or so, you'll start getting some relief from the nasal steroids. If we start allergy shots, it's a little slower process because the allergy shots don't have any medicine in them. There's not a steroid in them. There's not an antihistamine. That's why a lot of people like these. Insurance companies cover them because they're preventative therapy. So basically all your shots have in them is purified pollen, dog and cat dander, dust mites, whatever sensitivities you have on our skin tests are put in your shots. And each week you get a stronger and stronger shot, almost like a vaccine approach. So gradually over a matter of 2 to 4 to 6 months, you'll start to notice changes in your immune system where you quit overreacting to the ragweed in the fall or the spring pollen or the grasses or the indoor allergens. So this is more of a gradual process that changes your immune system long term. So it's more of a cure versus just a 24-hour Band-Aid like the antihistamines.
Right. And that was the point that I was going to make. Once you get these allergy shots in your system and they have had time to develop, it is more of a long-term plateau in easing the problem.
Correct.
What kind of food allergies do we typically see in the fall that kind of spike up?
Well, food allergies can present any time of the year. We usually don't see a seasonal change with food allergies. However, you hit the nail on the head. We've got Thanksgiving coming and we've got Halloween coming.
Right.
So these are high periods of reactions, not necessarily that you've developed all of a sudden a peanut allergy, but that you've accidentally been exposed to a candy that may have peanut in it that you didn't realize from trick-or-treating, or you're at grandma's house for Thanksgiving dinner and there's a pie that may have something in it that you didn't appreciate was in it. So that's the concern, is not so much that we're going to have new food allergies develop, but that your current food allergies can get exacerbated by an accidental exposure because we're eating foods at people's homes that you didn't prepare, or you're out trick-or-treating eating candy that you may not know exactly what's in it. But obviously it's going to be the peanuts, and the tree nuts are going to be the big ones: egg, milk, and wheat. So those are year-round ubiquitous food allergies, but as you mentioned, we're going to see peaks when it comes to our seasonal festivities.
And the allergies particularly more susceptible for the younger generation. Hold that fist up. I'm going to give you a fist bump, Dr. Cromie. We got to hold it real still. Bam! There you go. We're out of here, Dr. Marc Cromie, Chattanooga's favorite allergist for going on 10, 12 years now. Chattanooga Allergy Clinic. Check them out on the web, ChattanoogaAllergyClinic.com.